let's get started. I'd like to, with great pleasure, introduce two wonderful speakers this morning, Dr. Caroline Lukaszyk and also Dr. Jagnoor. Caroline's from the World Health Organization and Dr. Jagnoor is from the George Institute for Global Health. So welcome to you both.
Hi, good morning. Good afternoon, everyone.
Great to be here. Caroline. Good morning, Jagnoor.
Hello, good morning, everyone.
I think actually we just clicked over to good afternoon, but Caroline, you've given it away. You're actually in Sydney. Perhaps we could start with you introducing yourself and telling us a little bit about where you come from and how you found yourself in the drowning prevention space.
Yeah, absolutely. Thanks so much, Justin. So again, good afternoon, everyone. My name is Caroline Lukaszyk. As Justin's mentioned, I work for the World Health Organization, and I'm a technical officer for violence, injury, and alcohol at the Western Pacific Regional Office. So usually I'm actually sitting in Manila in the Philippines. And as Justin's alluded to, I'm very happy to be back in Australia. I'm visiting friends and family for the next couple of months. But I think the way I've really got here is it's quite interesting. And I'm very lucky also to have Jagno, who is a long-term colleague and mentor as well on this call, who really got me involved in drowning prevention when I was still heavily involved in research through the George Institute of Global Health. And though I started off having quite a broader interest in injury prevention and violence prevention, I think especially once traveling, doing a lot of field work and really understanding how much people, especially in middle-income countries, live around water bodies, rely on water bodies for food, for work, for transport. It really contextualizes why drowning is such a huge issue within the Western Pacific and Southeast Asian regions, which is where I'm primarily working right now. So I hope that's a good intro, Justin.
Absolutely. I do think drowning prevention is infectious. So I really love to hear when we've converted people from injury prevention, particularly into the drowning prevention family. Dr. Jagno, you're another convert. So how about you introduce yourself and give us a little bit of your background?
Yeah, okay. I'm not committing to any conversion at the moment. It doesn't go very well in the political space that I often hear about. So no commitments as yet, non-committal. Lovely to see you too, Caroline, and welcome back. So I am a senior research fellow at the George Institute for Global Health, and I co-direct the WSO Collaborative Center for Injury Prevention and Trauma Control. My sphere of work, I think, like Caroline, I started with verbal autopsy, and my major interest was methodologies, and then kind of moved into specialization in injuries. And I work globally, so I like to call myself a global health researcher with specific interest in injuries. And yes, a lot of people trying very hard and perhaps successful to most of the extent, given the lovely personalities there are in the drowning field. So happy to be here and looking forward to listening from everyone. On that note, actually, just a moment, Justin, I saw Floss was online as well. And as much as drowning excites me, I think I'm more excited by the stretches that Floss has been making us do when we are not virtually on. So I look forward to some of those on recording, perhaps. Thank you.
It does take us back to the workshop where the Australian Water Safety Strategy came from, which is way back now in 2019, pre-COVID, where we had Caroline and Jagno participating. I guess there's some people sort of scratching their head wondering if this is the Australian Water Safety Strategy, why do we have two global health experts on the call? I think there's many of you that have seen, but some of you are perhaps not aware specifically that in April, the United Nations declared its very first global resolution on drowning prevention. And so we thought this would be a really great opportunity to talk to Caroline and Jagno just about the regional and global perspective in which we interact and intersect. So that's what we're going to do for the next little while, is talk about what's going on in the region, what drowning looks like in our nearest neighbours, and what that might mean for drowning prevention globally, but also contextually in Australia. I think we'd like to start just with a short video. This video has been seen by some of you, but perhaps not all of you. This is a video from the UN General Assembly from just a few months ago in April, weeks ago in April.
Mr. President, in the last decade alone, more than 2.5 million lives were lost to the water, needlessly. Infants slipping silently into ponds, fathers never returning from fishing trips, sisters submerged on their way to school, wasted lives and preventable deaths on an epidemic scale. Drowning is a major and neglected cause of global mortality. 235,000 lives lost every year, 650 every day, 26 every hour. Astounding, staggering figures. Annually, a greater loss of life than to maternal mortality and malnutrition. It is an issue without geographical borders and boundaries. Anyone, anywhere can drown. It affects every nation of the world, and some more dramatically and inequitably than others. Over 90% of deaths occur in low and middle-income countries, the highest rates recorded in Africa and the greatest numbers across Asia, with children and young people representing the majority of lives lost, our future. Despite its global burden,
so that's just a vignette from a speech that was really quite inspiring and empowering from the ambassador from Bangladesh. Carolyn, 90% of drowning occurs in low and middle income countries, most of those across Asia. You're working in Asia. Tell us all about what's happening and what you understand the burden of drowning to be in our nearest neighbourhood.
Well, I think this might actually be a very good opportunity for a quick plug of an upcoming bi-regional product being released by the World Health Organization. It's to be released on the 22nd of July, and it's really a series of 2 reports that highlight the burden of drowning in the context of drowning in the Southeast Asian and Western Pacific regions. To get to these reports, we've been doing a lot of work. It's been over 2 years now of traveling across the region, really trying to understand what is happening on the ground and why we're seeing these numbers reported. So I think what I can very confidently report is that it's been a huge learning experience for us. We've really understood the broad context of drowning across the region. Across the region I work across is very diverse. We include China, Mongolia, all the way down to Australia, New Zealand, coming across the entire Pacific and a couple of Mekong countries as well. And again, I sort of alluded to this in my previous comments, but sort of understanding the extremity of contact we have with water, especially in low-income countries. Again, a lot of people rely on water for livelihoods, for fishing, for other water-based activities. Transport, again, especially in our Pacific Island countries like Papua New Guinea and Solomon Islands. Small boats are used to travel very, very large distances over water, often in very unsafe conditions, often in untrained people and captains navigating the water. So again, you sort of really start to understand the complexity around addressing this issue, and you see how many different sectors and stakeholders are actually needing to be engaged to make these broader policy changes and these broader programs to really help keep people, communities and families safe around water.
Dr. Jagno, your work tracks across several countries, Vietnam, Bangladesh and India. What does drowning look like from your perspective in those countries?
I would just resonate what Caroline was just saying, that it is dynamic and it's complex across. Perhaps we are talking more about child injuries when we are limiting ourselves to these child drowning, particularly when we are limiting ourselves to these 3 countries. But even within these contexts, the risk and the complexity with geographical disparities becomes really big. And as we talk about drowning, it's also important to understand that might or might not be a political or community priority. And then talking about the WHO or the global agenda languages, and something that even Ambassador Abab was reflecting on, it becomes about social determinants, commercial determinants, as well as environmental determinants across these countries. And so to me, that is the reflection and the intersection that happens all along. And just to be clear, when I talk about social determinants, I'm not talking about socioeconomic inequities. Another thing that we heard about in the vignette, what I'm talking about is the longitudinal, intersectional, accumulative inequities that contribute towards the drowning burden. So to me, that is a common learning across 3 contexts, that irrespective of where you are and what your exposure is or what your activity is, there are underlying determinants that influence your risk and exposure and the outcome for drowning.
Right. Carolyn, you like you haven't alluded to, you've gone straight to the plug, right? That's really good media training. And when Royal Life Saving, we get our team together to talk about media training, you know, one of the objectives is get the plug in and get it in early, because you never know what the moderator facilitator is going to ask you. So these reports are being launched. There is a date now. I think it's the 23rd, 24th, somewhere around that, a few days before the World Drowning Prevention Day, which is fantastic. Can you give us one or two of the surprises? Something
Sure,
you've learned that you
absolutely.
didn't quite expect.
Absolutely. So first of all, Justin, I will correct you, 22nd of July is the launch date.
Okay.
And perhaps a good way to sort of circulate this is invite would be to maybe email a list of the participants to today's event, and maybe we can share it that way as well. It'd be fantastic to make sure everyone has the opportunity to learn about these great resources. So some surprises from these reports. I think what is a little bit different about these, and I hope everyone really appreciate, is the amount of case studies and personal stories we have included in these reports. So I think one really incredible opportunity we had while traveling and understanding sort of the burden and the context of drowning, about what happens and why it's happening, is the fantastic innovative solutions that are really being driven by not only the high level government, but also community-based solutions. And the fantastic partners and stakeholders we have on the ground are already doing so much work on this agenda, and may not always feel supported or connected to a broader community also working in this space. So to try and really highlight this, we've brought together a lot of case studies and stories and quotes and personal reflections from stakeholders across both regions. So I think that will be a very interesting component of the reports for people to review. And also, I think at the very back of the report as well, I'm not sure if other people on the call are familiar with WHO status reports, we do have country profiles. So each country in both regions has a snapshot, a one-page snapshot that highlights the sort of progress made or the efforts made towards addressing drowning at the national level. And as this is the first report of this type that we're developing, we're hoping this will be a baseline, so countries will be able to reflect and look at exactly where they currently are with drowning prevention measures, and understand, hold on, there's more areas that we can make further progress on. And again, these reports can then be used as a tool to monitor progress over time and see how much progress is made in the next 5, 10, 20 years. So these are real hopes of the reports. This is, I think, what's exciting about them.
So the other thing we do in media training is we remind people that in a live interview, when the moderator asks a question, you get to answer whatever question you want. So you've doubled down on the plug. And I'll go triple. Like on the 3rd, I think on the 22nd or 23rd, there's also a webinar that people can dial into. And if you really have enjoyed listening to Carolyn talk about the regional context, there's lots of opportunities to engage. This is one of the areas that globally, I think, is growing very, very rapidly, and Australians can be proud of the contribution they've made. So I'm not going to give you an opportunity to talk about the 2 or 3 surprises now that you found in the report. It seems to me like we're going to have to wait to see those reports. And I do think that the case study vignette approach will be really quite inspiring. Jagno, can I ask you? You were involved in the workshop for the Australian Water Safety Strategy, and given your expansive work across the region, do you think there's any crossover between what's happening regionally and what needs to happen in Australia?
Good question. I think the recipe to success is kind of universal. So it boils down to 4 things. That is good governance, strong partnerships, dedicated capacity and resources, and evidence and evaluation. And as Caroline plugged in the bi-regional WHO report, I think that's a great baseline to start thinking about accountability measures. And also reflecting again on what Caroline was just saying, and hoping to listen more about what's happening at the community level in Australia, is the fact that we can talk about intersections between sectors and shared goals. But if we don't speak the same language and we don't have a good understanding of our shared goals or the core benefits that various actors, players at different levels bring in, it is kind of a missed opportunity. And so, yeah, I think that is a common challenge across global as well as local work that we all are keen. And it's interesting, the people in global health field would often say global health is actually local health. So maybe I should be more intrigued and engrossed in what's happening in my backyard.
Yeah, look, accountability is a good partnership. I think we'll find today particularly, we'll talk a lot about partnerships. I think that comes out strongly. Accountability is one of those areas that I think is challenging for us at an Australian Water Safety Council, water safety strategy level. I think this is very much a document of influence. We've got 45 people contributed to the strategy directly, and indirectly organisations were involved, but we don't control a lot. But we certainly collaborate and influence outcomes. But I do think increasingly that accountability conversation is going to be really important as we progress development of this opportunity arising from the UN resolution. There was another video, but we're not going to show it. We might drop it into the link in some way so people can reflect. That video goes to the Bangladesh context locally and what interventions look like. But we're going to wrap this session up. Oh, we were going to go to it, but we're not now. We're going to wrap the session up. So I'd like to thank you, Dr. Caroline, Dr. Jagnoor. It's been great spending some time with you. Thank you very much. And we'll talk again very soon.
Thanks so much, Justin.